Hello, this is Dr. Eric Bricker, Chief Medical Officer of First Stop Health, and I'd like to speak with you about how virtual primary care works. So first, virtual primary care is a combination of scheduled appointments with a primary care physician of your choosing that you see via phone or video visits, and 24/7 access to virtual urgent care, or what would be considered sick visits. So the chosen primary care physician might not be available at 11 p.m. on a Sunday night, but there is an entire team of physicians that are available 24 hours a day for the urgent care sick visits. So it provides a combination of scheduled and unscheduled visits to give tremendous access for people. And all the doctors share the same electronic medical record, so they can see what medications are prescribed and what happened during the visit. Next, virtual primary care also involves ordering labs that have to be drawn in person. That's completely normal. For things like screening for cholesterol, and if a person has diabetes, getting their hemoglobin A1C checked, that requires an actual blood draw. So virtual primary care physicians can actually enter the order through the electronic medical record to the lab, and the person just has to go to the lab and show their ID, who they are, and they can have their labs drawn there, and the labs have actually already integrated with the electronic medical records so that the virtual primary care physicians will automatically get the results back, close the loop with the patient, and define what they need to do. Do they need to prescribe a statin medication for high cholesterol? Does the person's cholesterol look great? That can be circled back with the patient. Next, virtual primary care physicians, of course, will also refer patients to specialists when they need to be. If a person has an abnormal mole that might need to be biopsied, then the virtual primary care physician will refer them to an in-person dermatologist. If they're having particularly challenging sinus issues, they might refer them to an ear, nose, and throat doctor. Now, the great thing is that virtual primary care practices will, especially from First Stop Health, will load the plan information into our system in advance, so we'll know what their network is, and we'll be able to send them to in-network specialists that also have convenient locations, have excellent cost and quality information, and we even screen them for appointment availability, because no one likes going to a specialist and then having to wait like 6 months to make an appointment. This way, when you get referred, you know you're being referred to a specialist that can see you in a timely manner. Next, virtual primary care physicians also refer for imaging. Now, typically primary care physicians refer for plain X-ray, but occasionally a primary care physician will order for a CT or an MRI. Now, in those cases, oftentimes the insurance requires a prior authorization for the advanced imaging. In this case, the virtual primary care practice will actually go through the hoops to obtain that prior authorization from the insurance carrier. Typically requires clinical documentation, which the virtual primary care practice will provide, so that the claim can be processed as appropriate and it can be covered. Now, the last thing out of many that virtual primary care practices do is, of course, they prescribe medications. Now, this is fantastic because primary care physicians are like the purveyors of generic medication. And there's like over 80 different blood pressure medications, the vast majority of which are generic. So many chronic conditions like hypertension and diabetes and high cholesterol can all be treated with very cost-effective generic medications. Now, to learn more about First Stop Health's virtual primary care, click the link below. Thank you for watching.